Hi everyone, welcome to my channel. I'm Kathy Curran, pediatric occupational therapist and psychologist, and mum of 2 special needs boys myself. Today's video is going to talk about the labels autism and Asperger's and which ones should be used and when. We're going to cover 3 points. 1, why are there 2 terminologies, autism and Asperger's? 2, when is the best time to use which terms? And 3, what does my family choose to use? But first and most important, I'm going to base the information on the latest scientific evidence that we have. So firstly, why are there 2 terms, autism or Asperger's? The American Psychiatric Association is the association that creates the diagnostic and statistical manual for mental health called the DSM. You might have heard of it referred to as the DSM-5 because that's the edition that's available at the moment. The DSM gets reviewed every 10 or 15 years approximately, and the latest edition was published in 2013. Asperger's was included in the diagnostic manual prior to the latest edition, the DSM-5. The big difference in the DSM between autism and Asperger's was that Asperger's tended to be associated with no or minimal impact in language and intellectual ability, whereas autism was noted to have more impact on language and intellectual ability. However, the APA, American Psychiatric Association, is very clear that each of the conditions in the DSM needs to be a standalone condition on its own. So they don't want 2 conditions that could be confused with each other. It has to be very clear that a diagnosis is the correct diagnosis for a person and that there isn't this blur between the 2 diagnoses. And research hasn't been able to find a clear borderline between autism and Asperger's in intellectual ability and in features. And so in the DSM-5, they included Asperger's symptoms, or what was previously known as Asperger's. They've included that now in Autism Spectrum Disorder. The term Autism Spectrum Disorder is quite important because it acknowledges that there is a wide spectrum in the difficulties faced by different people. But the term Asperger's continues to prevail. We still hear about it a lot, and there's several reasons for this. One is that many people would have been diagnosed prior to 2013, so they would have been diagnosed with Asperger's. Another reason is that there are many celebrities who either have Asperger's diagnosed or have Asperger's attributed to them. For example, scientists tend to believe that Albert Einstein and Isaac Newton had Asperger's. We don't have evidence of this, but this is what scientists believe to be the case. But there's a lot of celebrities nowadays that have openly admitted that they have Asperger's. For example, David Byrne, the lead singer and guitarist of Talking Heads, is diagnosed with Asperger's, as is Greta Thunberg, the teenage environmental activist. So now the question remains, which term should you use? And there you're going to have some different opinions. I think it's very important to remember that when talking to medical professionals, that you use the correct term for today, unless of course your child was diagnosed prior to 2013, but the correct term would be Autism Spectrum Disorder, otherwise known as ASD. But sometimes it may be more helpful to use the word Asperger's to describe your child or yourself. Because more people know about Asperger's, especially lay people, it may be more appropriate to use the word Asperger's when you're trying to explain some of the challenges yourself or your child may have. And so, in my opinion, it's okay to use the word Asperger's in a non-medical context. And lastly, I promised that I would tell you what myself and my family use, and I'll do that in 1 minute. I just want to ask that if you liked this video and felt it would be useful to other families, that you click that like button, which will encourage YouTube to recommend it to others. So for myself and my family, we use the terms interchangeably. My son is 12 years old and he has been diagnosed with Autism Spectrum Disorder, ASD. He's doing very well at the moment. He's in a mainstream school and seems to get along fine for the most part. But it doesn't take away his ASD. And personally, I've experienced that teachers will often not notice the difficulties he has or not be aware of the difficulties he has. And so I find that when I talk to teachers, I will prefer to use the word autism or Autism Spectrum Disorder because I find it helps them understand that he still continues to need extra support. And he will continue to need extra support for the foreseeable future. And using the word autism draws their attention to the fact that he does continue to need the support. But I also find that if we use the word autism to some people in the community, that they may have a preconceived idea. And this can result in my son being excluded or treated differently. So for example, when I want to enroll him in a camp, like for example a tennis camp, I've had the experience before that if I've told them that he has autism, they tend to respond with concern that they won't be able to meet his needs, that his behavior might be disruptive to other children and he might not be suited to the group. I find if I use the word Aspergers, they'll have a different opinion. They'll have an opinion that, okay, he'll have his moments where he needs extra support, but in general, he's able to function in the group. And so in our family, we will use the words autism or autism spectrum disorder and Asperger's interchangeably, depending on the situation, depending on the message I want to convey. And some people out there, and maybe even you, may disagree with me. Some people feel it's really, really important that we use autism spectrum disorder because it's a correct diagnosis. But I feel like it's more important that my son has opportunities, that he's allowed to engage in many different activities and with many different people. And if the diagnosis is impeding that, then it's important that we use the tools that we have available to us to allow him to engage, to be part of community, to be part of his environment. So I hope this video has been helpful to you. If you want, you can subscribe to my channel so that you get informed about future videos. But in the meantime, hang in there and keep moving forward. Bye.